Hi students, and welcome to week 2 of your Medical Terminology 2 course. This week we will be looking at the digestive and urinary system. The digestive system consists of 4 functions. They include ingestion, digestion, absorption, and elimination. Ingestion involves taking complex food material into the mouth. Digestion is the process by which complex foods are broken down into nutrients in a form the body can use. And then absorption is digested food passes through the lining cells or the epithelium of the small intestines and into the bloodstream. This is how nutrients travel to all the cells of the body. And then finally, elimination is the 4th function of the digestive system. Elimination occurs when solid waste materials cannot be absorbed into the bloodstream. The large intestines concentrates the solid waste, which is known as feces, and the waste passes out of the body through the anus. Digestive system pathology. Medical terms include chelosis, a disorder of the lips characterized by crack-like sores at the corners of the mouth. Leukoplakia, an abnormal, white, usually benign lesion that develops on the tongue of the inside of the cheek. Stomatitis is an inflammation of the mucosa of the mouth. Digestive system medical terms. So we're going to look at a few of these. The first one is ascites, and it's an abnormal accumulation of serous fluid in the peritoneal cavity. Bariatrics is the branch of medicine for the prevention and control of obesity and associated diseases. And then celiac disease is an inherited autoimmune disorder characterized by a severe reaction of food containing gluten. Other medical terms of the digestive system include the hiatal hernia, which is the protrusion of part of the stomach through an opening in the diaphragm. Inguinal hernia is the protrusion of a small loop of the bowel through a weak place in the lower abdominal wall or groin. Peptic ulcer are sores that affect the mucous membranes of the digestive system. Digestive system diagnostic procedures. The first one is abdominal ultrasound, and this is a non-invasive test used to visualize internal organs by using high-frequency sound rates. The cholangiography is a radiographic examination of the bile ducts with the use of a contrast medium. And then the upper and lower GI series are radiographic studies to examine the digestive system. With the upper GI, you would take a barium swallow. And with the lower GI, you would have a barium enema. Urinary system medical terms. The first term is benign prostatic hyperplasia. And this is an abnormal enlargement of the prostate gland, often found in men over 50 years old. And generally, when this is abnormal, you see this through a PSA test that's given. The cytopexy is the surgical fixation of the bladder to the abdominal wall. And then diuresis is the increased output of urine. Diagnostic procedures of the urinary system include urinalysis, the examination of urine to determine the presence of abnormal elements. Urinary catheterization is the insertion of the tube into the bladder to procure a sterile specimen for diagnostic purposes. Cystoscopy is the visual examination of the urinary bladder with the use of a specialized type of endoscope known as a cystoscope. Other urinary system medical terms include enuresis, which is the involuntary discharge of urine, hydronephrosis, which is the dilation of one or both kidneys. Incontinence is the inability to control the excretion of urine and feces. The urinary system medical terms: nephrolithiasis is the presence of stones in the kidney. Nephrotosis is the prolapse of a kidney into the pelvic area when the patient stands. Nephrostomy is the placement of a catheter to maintain an opening between the pelvis of one or both kidneys to the exterior of the body. Polyuria is excessive urination. Pylectomy is a surgical incision into the renal pelvis. Urinary system treatment procedures include dialysis, which is a procedure to remove waste products such as urea, creatinine, and excess water from the blood of a patient whose kidneys no longer function. Hemodialysis is the process by which waste products are filtered directly from the patient's blood. Peritoneal dialysis is the lining of the peritoneal cavity and acts as the filter to remove the waste from the blood.